Monday afternoon. I see the red light live button. I'm very excited to have return guest, Dr. Jason Hahn, with us today. Hey, Jason, great to have you. And before we dive into, we have some really enlightening things to talk about today. We have Jason's new book just released, The Martial Arts of Listening. However, one little housekeeping thing as we get started, we want to let you know that this is not personal medical advice. This program, as is our live streams on employee wellness and health, are for education, empowerment, and enlightenment only. If you are interested in working with Dr. Ovadia and his team on your medical concerns, please do reach out at team@ifixhearts.com. Okay, that was the first welcome. Well, second one, hi, Jason. Great to see you.
Good to see you, Krisna. It's a pleasure being on this podcast and just seeing you, right?
Yeah.
we have a good
Wonderful.
we have a great friendship, so it's always good to talk to you on camera
Yes.
for everyone to see.
And got to have those personal connections all the way around. So I'm going to jump right into it for our listeners that maybe aren't familiar with your work, Jason. How about you give us the shorter version of what you've been doing and what you are doing before we get to the book?
By trade, from the medical side, I am a physical therapist. I specialize in sports injuries. I am an entrepreneur as well. I have a multidisciplinary practice here in Pasadena, California, where we have physical therapy, chiropractic. We've really dove into regenerative therapies as of late. So different modalities, or we call them healing agents, in addition to hyperbaric oxygen therapy. Past about me, I was a former U.S. national team member in the sport of Taekwondo. And basically, that's what spawned this whole author. I wanted to write a book. Didn't know about what, but I basically married my Taekwondo career to my clinical career and wanted to show what makes me unique and how I'm able to help as many people as I can.
Wonderful. Sort of short synopsis or the Cliff Notes version of Dr. Jason and all his experience. And the thing I just want to say from a personal level, what I loved about the new book, and it's called again here, and you can see all my sticky notes. I can't read a book and not put sticky notes in it. The Martial Arts of Listening. Is this mesh what you talked about? You're the performance, the athlete, Jason, but with the physical therapist side of you. And there's just so many things to talk about. But I'm going to sort of kick it off with something that really hit me. There's a section in the book where you call prioritizing, and I have to make sure that I read it correctly, Texas-sized dysfunctions, about tackling the biggest first and not trying to do everything at once. Can you expand on that a little bit for us?
Yeah, I think you can apply it to many facets in life if we're talking about a patient and we focus on the minuteness. That you're always going to find things that are not the best, or I don't want to call it wrong. But as a clinician, let's say I have five things. Let's say I find five different impairments. I want to focus in on the top one or two first, because if we hit all five, we don't know what worked or what didn't work. So we're going to go to the top one or two, give some type of treatment, whatever that may be, and then see if we get a result. If we are getting great results and then we have time, or it makes sense clinically, we can add the third one. But it's like, I don't like pills, but let's say we're going to use the analogy of pills. I'm going to give you five different pills and then you feel great. So for life, I have to do these five different pills? Maybe not. So it's basically taking that same approach learning how to think critically, clinically, looking at the person in front of us, not the diagnosis, but look at the person, and then figure out what are those exercise dysfunctions. For instance, if someone's dealing with knee pain, I might find two things orthopedically I need to do, but if them themselves is always uptight or in a sympathetic nervous system kind of state, I may need to tackle that in addition to the knee. So it really depends on who's in front of you and listening to their entire story to decide how best to tackle this situation.
Oh, fantastic. And before we even go any farther, I do want to encourage our listeners, viewers, wherever you are, please put your questions, comments in the chat. Nicole will be there to answer any of them. And also, we can address those as they come up. So please, we'd love to make this work more interactive with you. And this, what you're talking about, Jason, is something we see both in our medical practice and our employee wellness programs. Is people can be overwhelmed by what to start with, right? What to fix, and helping them prioritize that is, kind of the goal of a coach or of a clinician. I've obviously read the book a couple times now, but our readers may have not. But this martial arts of listening, it incorporates more than your ears. You have some
Mhm.
very nice chapters about listening with other modalities. How about you talk to our listeners a little bit about other ways of listening?
Yeah, I talk about the five principles of listening. So everyone thinks of listening as listening with your ears, and that's your primary one. But I would challenge anyone to think about it's just because you hear it doesn't mean you're actually listening. I use the analogy in my book. I'm talking about my wife and I, and my wife says something to me, and I'm hearing her, but I'm not necessarily listening. And then she comes back to me and she goes, "What did I say?" I was like, "I don't know. I I heard you, but I wasn't listening." So, there's escalations and there's different levels to each sense. So the first one is listening with your ears. And then from my side, I listen with my eyes, I listen with my hands, I listen with my brain to put all of the information together. But ultimately, as a medical practitioner that treats people, and I think it extrapolates not just to medical practitioners. If you care about a friend, you listen with your heart, because you essentially want to take those five principles and then let that guide the way that you want to help the other person. And it's important to not neglect that we have these five different senses, and just to improve our communication overall.
Uh, and without trying to give advice here, I think this is something we hear in our both the medical practice as well as employee wellness programs. Is often, and I want to say often, on a regular basis, clients, patients will say, I just don't feel heard. That they feel that they might just be a number. Appointments are often very short, and that they don't feel that this whole person is being personally addressed. Is this something you've confronted, and maybe a reason why you're not within the normal corporate structure of physical therapy?
Yeah, it's essentially that. I wanted to create an environment where we could heal people. And that's one of them is the time to listen to them, the time to hear what they have to say, the time to listen to their entire story. If you think about medical care nowadays, it's like you said, it's so fast paced. I think we're so used to like our phones and just we want immediate gratification. But in health, wellness, and lifestyle, it's not that easy. We really have to peel the layers of the onion to find out what's at its core in order to truly help someone. So that's why here at HealthFit in Pasadena, we are completely one-on-one with our clients. We don't use aides, and everything that we do, whether it's the subjective questioning, whether it's the manual therapy, whether it's the therapeutic exercise, we are constantly evaluating, we are constantly communicating to figure stuff out behind the scenes. It reminds me, just recently last week, one of my therapists, she asked if I can jump in one of the treatments. Things weren't making sense. So let's say she is a low back patient. The low back, we were doing the right things, but something was missing. So in my conversation, in my examination, we started to talk. I asked the question of, so she's coming in for low back. She had low back pain, but then through testing, I started to ask, oh, do you grind your teeth? Do you clench at all? And she's like, oh, I wear mouth guards. I was like, so essentially you are grinding your teeth or clenching. And I worked a little bit on her jaw, I worked a little bit on her neck, and then her core started to hold. She could hold the contraction. Her pain was reduced substantially just by addressing her neck, but she's a low back patient. And then through conversation, I believe the left side of her neck was considerably more tonic than the opposite side. So I asked about the work situation. She works at a desk, two different monitors. And I said, which one do you look at most of the time? I look at my left one. And I said, why? That's where all the emails are. So I said, okay, how are you doing it? Again, it's asking questions, it's listening, putting the pieces of the puzzle together. So she sits at her desk and she always looks to that left side. So I'm working on that a little bit, and then she's able to engage her core a little bit more. And then we started talking about the book. But she loves like fantasy, and I was like, oh, you probably will never want to read my book. But she spends 2 hours a day reading. And then she says, to think about it, to think of it, my lamp is on my left side, and I'm holding these huge fantasy books in my left hand for at minimum 2 hours a night. So now it makes sense. So when we did this exercise, we did it where she was balancing, and I had her turn her head. And then when she turned her head to the left side, she had a really hard time just stabilizing. So now, again, it's the martial arts of listening. What we do as practitioners, if we can listen, then we can find those little bits and pieces that weren't making sense initially, but to put context to it. Then we could address her accordingly. But that sticks out in my mind because it just happened last week. But I say good questions lead to good answers.
Uh,
So to take the
100%.
time.
Yeah. And that takes time, of course, which most general clinicians in a medical setting or a physical therapy setting do not have the time for, sadly. And if, again, want to reach out to our listeners, if you want to know more about Jason Hun's work and his book, here's the link there. Also, if you're interested in finding out more about our Ovadia Heart Health programs, you can also reach out to us or look on the website, Ovadia Heart Health /wellness. And also in the chat, Mikola is here. You can reach out to her at ifixhearts.com for a real person to talk to. And I want to just go back, Jason, to something, it's just slightly off where we've been talking about these different ways of listening. Something that jumped out again from the book to me was when technical skill is not enough. So we know doctors have lots of degrees. They spent lots of hours in training, same with physical therapists. But training is not always enough, right? You can have all the theory and certainly, I come from the professional dance world. No one learned how to dance by reading a book. Or if they did, at some point they had to get up and move. This is something we hear frequently, that patients feel they're being told something that is in a theoretical form or a book, but doesn't maybe apply to them.
Yeah, I agree. It's looking at the term like book smart doesn't equate street smart. And it does apply to every clinician or artist to any sense, right? It's how can we take the book smart and then make it make sense? Because we have a new clinician coming on, and then we talked about, and he's a newer grad, but very, very talented, very, very book smart, but just doesn't have enough reps. So reps is one, but we want good reps. So if life is not black or white, it's gray. But it's important to understand the extremes of black and white. But when we have the human component, how do we find that balance in the middle? It's like working with a client. Ideally, I'm going to have you eat right, exercise right, um, proper biomechanics. In my world, if you can do it 100% on my end, then I feel you'll get better faster, but not everyone's there. We have to meet them where they're at. And slowly, let's say they come 10%, I come 90%. Ideally, once we start to see some improvement, then they'll come out of that skepticism. There'll be a little bit more trust. And then we can slide them a little bit more, 15%, 20% towards my direction. So it's really about that. There's the human component that needs to be addressed with every situation. I'm not treating your knee. I'm treating you as a person that happens to have knee pain or knee arthritis. So, but if I only treat you, I'm not a surgeon. I'm not, I'm not just, I'm not going to put your ACL together. I'm going to look at your worries, your fears, your history, in addition to how much you're able to give, and I'm going to meet you where that is. Hopefully, we get an improvement, and then we can slide further towards you or further towards me. But it's really just building that relationship so we can get positive gain.
Mm. Uh, I'm loving this, and again, keep if you've got questions, please put them in the chat. And what would you say is one of the top 2 or 3 issues, sort of putting a barrier between that partnership happening? I'll just throw one out that we see a lot is fear. People are afraid that they're going to still be in pain, and maybe this gets to one of the concepts that I liked about your decision making, right? And we'll get to that, kind of 3 choices. Do you see a lot of fear within your practice, or are there other sort of things that you're seeing happen more frequently?
No, absolutely. Everyone's in a different place. I would say the fear comes because of a variety of reasons. Maybe they've been to multiple practitioners in the past, and they've again, what we say is quite powerful as medical professionals or anyone, even friends. Sometimes we can say something that just triggers them or gets them, uh, makes people fearful. So, like, imagine someone coming to me with back pain, but their doctor said, I never want you to lift more than 10 pounds. Imagine that. Like, how do you live? You can't live. So for someone like me that says, no, I'm going to get you to lift 10 pounds and up to 150, 200. Like, or imagine a new mom that says, the doctor says, because you're back, I don't want you to lift more than 10 pounds. Like, how am I supposed to lift up my child? And then that's very indicative of a medical practitioner that didn't use their street smarts. Like this, I'm talking to a mother that has a kid that weighs 15 pounds, and you're telling them because your book said don't lift more than 10 pounds. There's a disconnect there. So there can be fear from a practitioner that um, maybe you've been misled in the past, or maybe you didn't have any success. So it's important to address the elephant in the room at times of of if they are fearful, ask why. Well, and then, or maybe that's like they've been to other people, like I said in the past, and they don't know if they want to trust you or not, and that's a valid concern. So I would say is I don't expect you to trust me 100%. I wouldn't trust me 100%. But what I want to do is meet you somewhere in the middle, and let's work together to get some improvement. And my job is to help you along this journey, and then hopefully you see you start to hit little milestones of success. And then sooner or later, if we do have that success, we will build even more trust.
Mhm. Um, and this is something that we will see oftentimes. Individuals come to our practice, and someone has actually really scared them. They say, if you don't do this or you don't do that, you're gonna. We've even heard people say things like they've told them they're gonna die. Um,
Mhm.
and it is what you say. You have to build that trust as an initial ground. And I see we've got up here our soon to be released case study on our employee wellness programs. If you're interested in finding out more, it's not yet out, but you can get on the waiting list for it. And we talk about trust and we talk about fear, different things. But that is the link there. What's something from the book that I haven't sort of nibbed on yet first that you'd like to share with our listeners, Jason?
Um, I think it's a very personal book to me. It's very autobiographical in nature. The If we look at the genesis of it, and when you're trying to come up with a book topic, and I wanted it to have impact, but I wanted to be ingrained in me. As as you know, I was a very high level competitive athlete, and it's interesting. I've been a physical therapist 18 years now, and Taekwondo has always been a big part of me, but I haven't spoken about it that much. And I always looked at it as the Taekwondo was my past. It did help me um, decide on my career, and it has like put in discipline in me, and a lot of my work ethic comes from that. But I never put two and two together of why I am so passionate about the field of rehab and regenerative medicine and physical therapy. And it wasn't until I was taking like a public speaking type of course, mastermind. And with any good program, it really gets you to dive really, really deep into your soul and gets you emotional, and it put yourself out there. And throughout that journey, I was able to find what was it. And then for me, it was not making one of the big reasons I didn't make the Olympic team, I feel, was because I suffered an injury that didn't allow me to perform at my best. So when I started to explore that a little bit more, and dove into that part of my life, that it's weird, you try to shut it off, but so I was doing this mastermind course, and I'm speaking in front of 100 other speakers, and I'm bawling on stage, I'm crying, talking about this moment. And then those are the moments where like, that's it, that's what drives you. And then so I was like, okay, that was one of the big factors that has spearheaded my career. But then one of my coaches asked me, what sets you apart, or what sets HealthFit apart from everyone else? And on the surface level, it's, oh, we have one-on-one care, or we have great manual therapy, we have great exercise, we can bridge the gap between physical therapy and sports function. And I think that's very superficial, which we do. But my answer was ultimately, we listen. And she says, how does that make us different? I was like, because of everything that I've just said earlier on this pod. It's like we're getting to know someone. And I spent over 10 years in professional sports, and you have the luxury of being with an athlete 24/7, 6, 7 days a week. And there's that relationship with that athlete. It's so telling, because you know the ins and outs of their life, you know the ins and outs of training, You know the ins and outs of every different part of practice we did that day. And that's how we get people in professional sports, like back on the field or back on the court even faster. Is yeah, our skills are good, our technology is good, but because we know the little nuances of them and their life, we're able to make these micro adjustments as we go. And I feel that that's one of the secret sauces to why some professional sports teams are able to achieve um, some more success than others.
Mm. Um, Lots of information for our listeners. And again, we'll put up where you can find out more about Jason, about HealthFit. And I do want to talk about the HealthFit blueprint. That was one of my notes to myself today. If you're interested in talking to anyone about our employee wellness programs, reach out to Michaela. Here we've got some links up on the podcast. um Someone put in the, how do you look so young in such a stressful profession, Jason?
I don't know. Maybe it's my wife's skincare for me. I don't know. It is. I I know I try to be myself as much as possible. I try to have fun. I would say my team says I have the humor of a 12-year-old, but when it's time to get business done, I'm probably like I act like I'm in my yeah, in
Yeah, you have
the
to be
age that I
careful with
should be.
it.
Yeah, I stopped myself.
I know.
So
You caught yourself there.
I
For
did.
our listeners, I'm a few decades older than Jason.
No, you're still great.
But
You
that's a
still
fun
got that
question.
the dancer vibes in you, Krishna.
Yes. Well, many, illustrious choreographers who say once a dancer, always a dancer. And that's something I wanted to pick on. As you said, those of us who've had, whether you call it a previous career, or I'll sometimes use the phrase another life, back in
Mhm.
my dancer's life, which spanned more than 30 years, that still carries with you. But we do try to park that now and then. But I think you've done a great job. And I want to remind everybody in the book of bridging that gap between your professional, in your world, athletic, sports, competitive world, into your physical therapy work. So the HealthFit 4-step blueprint, because there's a piece of that I feel really connects to the work we're doing with the Ovadia Heart Health team. First, can you share with our listeners the 4 steps, and then we can pick it apart a little bit?
Yeah, so it's predicated primarily on my success in professional sports and how I would get someone from an injury back onto the field. And the idea is we're not just treating the injury, we're treating the person, and we want to get them back to not just on the field, but better than they were before. And I think that's something that's quite important. And we get them better than ever before by following the process. So the first part is the assessment. It's a complete evaluation where, like I said, we want to know their history, want to know all the ins and outs. And there's no such thing as this is not relevant. Most of the time, someone will say, like, they're coming in with back pain, and hey, have you your hips, your neck, your shoulders, your ankles? More oftentimes than not, let's say it's right-sided low back pain. They may, if they've had ankle sprains or recurrent ankle sprains, it's mostly on that side. So the studies will show that there's a correlation between weak hips and ankle sprains. Chicken or the egg, but you usually see both. So it's important to get that complete history in the assessment. When someone comes in with back pain, and let's say I'm looking above and below, but I'm saying it's like, okay, I think it's your ankle that's causing this entire thing, but your back hurts. So I need to be good at my skills in order to alleviate, which is the next step. You assess and then you alleviate the pain. So in order to alleviate right-sided low back pain, I need to address the low back, I need to address the hips, and in most cases, the thoracic spine or your ribs. So then we can decrease your pain, decrease your cortisol levels, get your parasympathetic system to rise up and your sympathetic to rise down. When you're in a good nervous system state, it makes it even easier to heal. The next step is correct the underlying problem. So, like, let's say we alleviate your back pain, but we never address the ankle or the hip stability, or in that one case, the one woman with
The neck.
left-sided neck pain. If we don't address that, it's going to come back 100%. You never address the underlying cause. So we want to correct the underlying cause as well. Last but not least, we take all of those bits and pieces and we get you stronger than ever before. We show you what what you're truly able to do. And I think that is the magic sauce, because someone wants to pick up their grandchildren. Okay, let's say that's your ultimate goal. Our goal is that you can pick up your grandchildren, you can carry them, you're going to go on a trip to Europe, you can carry them, and you can be the person you want to be. Like, if you're a grandparent, you want to be that vibrant person that you were for your grandchildren and your kids when a few years back. How do we unlock that for someone? And then some of that becomes with, yes, we can get them out of pain, but to allow them to realize that life is bigger than just this back pain. It's functionally, what are you able to do? If you can functionally grab your grandchildren off the floor or reach into the crib or whatnot, but now you're able to pick them around the house, talk with your family while you're with them. And what does that extrapolate to? Hey, let's take a family vacation together. I got you. Like, you guys go on date night while grandma, grandpa can take care of the grandkids. Like that if you can, like, if you can look at life that way, and as a physical therapist, I want to give you that life if that's what you want. So if that's what you want, then let's come up with certain steps to get there, but it's all based on the assessment. I wanted to know your story. I wanted to know what you want to ultimately get back to. And as we work together and we build that trust, we're gonna make those dreams even bigger for you. And that's always the goal.
And this brings up an incredible point, because I think there is this belief also too, and again, this is reflecting a little bit our age difference here between Jason and I, is there is this norm set now for people who at that age that you're just going to be okay, or you might even be slightly handicapped with a poor shoulder, a bad knee, a bad ankle. That there, I think there's a lot of, let's say, expectation that we can't age vibrantly. And I love this 4-step program of what, and the last one is to, as you said, make you even better than you were before. And I would hope that a lot of people in my age group would read this and say, okay, you know what? I don't have to settle for mediocre. I can be better than this if you find the right practitioners.
Yeah, absolutely. It's easy to say, oh, it's just I'm getting older. It comes with it. And there are natural processes that happen with age, but I feel in most cases there are ways to unlock it. And I think you alluded to it. I can't say I'm going to get you to 100%, 110, 120%. But I think we can improve from where we're at. And then if we do make that improvement, we're constantly we're constantly assessing where we're at and what's working and what's not working, and then we move in the positive direction. Improvement is the key. If we think too much about, like, ooh, I want to get to 100%, but I'm only 20% at this point, it's going to be really hard to get there. Everything in life is a process. You don't get a doctorate in one day. You get a doctorate by studying time and time and time again, and then stressing yourself in a way to get improvement. And it's the same thing if you want to get out of back pain. 100%. It starts at 1%, 5%, 10%, 15%. And then, but even that, if we don't get to 100%, doesn't mean we're not a failure. If you gave someone a choice, they go, would you rather be where you're at right now or 20% better? I think most people would choose 20% better. It's the ones that go, I don't want to, I don't care. Those are a little bit harder to help. So,
Absolutely.
so it's kind of like we, again, have to meeting somewhere in the middle. If I'm talking to someone, is 20% good enough? Or is like okay with you to start? I only want 100%. I was like, I might not be the person for you.
Yeah.
Simple as that.
It is such a partnership. And I, as we think about, we're working in two kind of components at the Ovadia Heart Health team. We have our medical practice. And if anyone's interested in that, right, you can reach out to us about our private medical practice. But we also have our employee wellness programs. And the last time you were on, Jason, you had some great sort of tips about the workplace. One was, just do a little more than you're doing today,
Mhm.
which is being repeated by our team frequently. So thank you for that. Um, what are some ways, listening is something we hear about in the workplace too, whether it's your boss who isn't listening to you or maybe even a colleague. What are some of your listening tools in the book that we could extrapolate to help in the workplace?
I think in the workplace, and I will use personal experience. No one is perfect, including me, you, every employee. And I think it's to put yourself in a place where it's okay to be vulnerable. If you can put yourself in that place, then you can develop that trust amongst each other. Um, uh, for instance, if an employee is feeling not praised enough, not validated enough, I think it goes two ways. In general, as a whole, we should show more gratitude. That's one of the things that I need to improve on, and I feel that everyone needs to improve on. But at the same time, from the person receiving the gratitude, do we necessarily need that to achieve good things? So it's a it's a combination of listening to each other, showing appreciation to each other, but also for the individual, whether it's myself or my employee or my co-owner, to work on themselves, to find appreciation and gratitude in themselves. I think if we're able to do that and we're able to listen to each other, but also listen to when you say something to someone, are you listening to what you're actually saying? Are you listening to the way that you feel? Those are things to take into consideration, whether we're amongst peers or leadership or whatever the scenario is. And I don't think anyone loves criticism, but if it's coming from a place of love or coming from a place of respect, that the person's coming from a good place to help you, then we can let some of the walls down in order to self-reflect and take that advice and see if it works for you, and then try it out. Again, there's no such thing as a perfect work environment, and but I feel the best teams, the best organizations are those that are able to talk to each other in this way, are able to keep each other accountable, are able to call it out when times are tough. And I think that camaraderie of a team is the same camaraderie we're trying to build with our client or our patient. I always use the analogy of, let's say I'm scared to tell my patient the advice that I really feel that they need. I'm doing them a disservice. Yes, I have to work on my tact to do it in a good way, but I'm doing them a disservice if I'm scared of hurting their feelings. Simple as that. It's like if someone's dealing with severe knee arthritis and they're severely overweight, if I don't say like, hey, it might help to decrease some of the pounds or whatnot, I'm doing them a disservice. But I want to do it in a good way. But it's not being scared to say the things that you need to say because it's coming from a good place,
Uh,
and listen in different ways with your ears. The I say your eyes because you're reading body language at the same time. As a mechanical technician, I watch the way that people move. I'm like, ooh, because they move like this, they're not using this muscle, or because they're painful, they're avoiding it, so they're shifting more to this side, and that's what's causing all these things. And then when I listen to my hands, whether it's in an examination or I'm doing some manual therapy, there's a reason why this thing is holding on for dear life. And there's a reason why this thing is really, really soft because it doesn't work. Putting it all together for the patient and then telling them what I think they need in a good way, meeting them somewhere in the middle.
And this is so important. Also, too, I know your team works very much in a team fashion. Of course, you're the leader, the owner, but this collaboration of different people listening, right? And this is important also in the workplace, especially when it comes to our health. There might be certain mandates that have been set forth in terms of safety that you need to follow, but how those things are related to individuals and listening to what works individually.
Right. It's
Uh,
looking at the big picture. Why are we doing this? We're here to help people, and not everyone's the same. So how do
um,
we develop systems and processes to get the job done?
Absolutely. Um, I'm just checking up on it. Maybe it's a good segue here. Made again for anyone listening. If you want to get a hold of Jason Hahn, his new book, The Martial Arts of Listening. Whether you're in healthcare, whether you're in business, an athlete. There's some things in here for the professional dance world too. It's a great read. The first quote that came to mind after I finished it the first time was, "The body never lies." This is a quote from a very famous choreographer named Martha Graham. And you see that time and time again. And one of the things in the book you talked about was maybe not listening to your body. That can happen even if you're a top athlete, right? You say, oh, I don't need, that little thing isn't, but then that thing grows into a big thing.
Mhm.
um, how about we touch on that just a little bit, how to learn to listen to your own body?
Yeah, I part of it is just respect for yourself, respect for like you said, respect for your body. And I use the analogy like most people push through the pain, especially athletes, especially dancers. You push through the pain, but the biggest predictor of uh, an injury is a past injury. If that past injury was never resolved, kind of like a car, your tire is off, but you never realign the tires. You never improve the tread of that one tire that you damaged. Sooner or later, the axle, the engine, or whatever else is may degrade as well. So I think it's if we're looking at it from a professional athlete standpoint, you can look at it as I just want to push through the pain. I want to play this game. I want to play this match. But if it turns into something that's a bit longer, a little bit more tougher to treat, then what happens? You're not able to play the game. Your overall performance may degrade over time. You may not get that contract or that pay that you want, all because you neglected that first thing. So I think whether it's yourself or being surrounded by people that you can ask questions to, is this pain normal? Is this something I should worry about? Do I need to stop? Can I keep going but still address it somehow? That's what everyone needs. It doesn't have to be a professional athlete. Time and time again, people will come in and they have a lot of these questions. And there is no such thing as a bad question, because if it's in your head, it's valid, and it's up to um, hopefully a good practitioner to give you the answer, to not fear monger you in a way that it's just real, and it's okay. We can get through it, or maybe we shouldn't be running 30 plus miles today. Like I said, meet somewhere in the middle. Let's meet somewhere in the gray.
As we get close to the sort of closing here, I mean, what you're really talking about is a new form of healthcare, really. Okay, you run a physical therapy business. You now have the book. And you have other adventures you're doing, but this is not the norm in our current system. I've used anecdotally that we have a sick care system, not a healthcare system. We treat diseases, and but we're not looking to be vibrant in life, to have a higher level of performance, or at least be better than when you came into the to your practice. What are a couple takeaways for whether it's a provider, a practitioner, a coach, or an athlete to keep moving in this direction? Is it simply just read your book?
Well, you can. No, I would say it's really self-reflection on what kind of person do you want to be? What kind of practitioner do you want to be? We just brought on a new clinician, and he came from an environment that was treating multiple people an hour. And this individual is a great person. He's very empathetic. And when you come out of school, or you decide to be a physical therapist, MD, you come out with this idea that I want to help people. But if you're put in an environment that doesn't allow you to do it, in a sense, like let's say it's logistics, I'm treating 4+ people an hour. How can I actually get to the root cause of this problem? It's nearly impossible. So this individual, he felt like why am I even a physical therapist if I'm not able to give it, because my hands are tied because of the insurance system or whatever it is. And fortunately, he found us, or we were able to find each other, and we have an environment that allows him to treat the way that he wants to treat. And at the same time, we have to coach him that these things are possible. But if you're so set in your ways of like, this is what you're used to, without allowing yourself to learn new things, to put yourself out of your comfort zone, I say be comfortable being uncomfortable, so you can deliver a higher level of care and service. And in the long run, if you are that empathetic person, if you are that person that wants the best of the person that's in front of you, then you'll give all of the effort, you'll give all of the time, you'll give all of the heartache, because you start to see the result. And then that's confirmation of why you've chosen to be in this field. So if you're in it just to churn patients through and just give them subpar care, that's okay. That's just not the way that I'm running myself. So I think in our practice, we bring in clinicians, not only clinicians, but front desk, front managers, operations, market, even from the marketing side. We're trying to market this because this is who we're trying to help. We're not marketing quick fixes. We're marketing, we're partnering with you to get you this goal, and to show you there's a goal beyond that. And if that's you and that's your personality and that's who you strive to be, this might be a good place for you. So long story short, I would say challenge yourself and ask, what do I want from myself, and what do I want from the people that I'm helping? If it's a higher level than you currently are, you're going to have to put in the effort. You're going to have to put in the time. You're going to have to put in whatever it is to master that. Because if you're just in a mill where you're just passing people through, and here's a sheet of exercises, here's my 2 different manual therapies that I do with this, without critically thinking, your results are going to be subpar. And we want the standard of health to be higher. And so it's really a reflection on yourself and who you want to be.
And you are setting a new standard. Congratulations on that. It is of a higher level. And I know that Mikla has put her iFix Heart's address in the chat. If any of you would like to reach out to find out about our employee wellness programs. And if you want to see some of our white papers, we have at least, I believe we're up to 7 now on our website. And we will have coming out very soon a case study on one of our clients. And you can get on the waiting list for that paper. We've got lots of things. Jason, we could go on for hours. I'm sure we'll be having you back here soon. Again, to read Dr. Jason Han at his practice in Pasadena at HealthFit. And, you know, the book is, like I mentioned, for everyone. Yours won't come with the little sticky notes in it like mine, but those do help me find what I like to reread. Thank you so much.
Thank you for having me. It's always a pleasure, and I appreciate you listening to all my rambles.
No, you're doing great work. You're at the forefront of change, and you know, something that we talk about in our team approach to, obviously we're working with a heart surgeon, Dr. Philip Ovadia, and the title of his book is Stay Off My Operating Table. We're trying to get people to not have to need his surgery, as you're trying to get people to be vibrant in life. So there's a lot of synergy there. And anyone reach out to us, download our case study, which will be coming out in a few weeks, and keep doing what you're doing, Jason.
All right. Thank you. Appreciate you.